What congenital heart defects are linked to Down syndrome and why? Imagine a tiny heart forming inside a developing baby. For some children with Down syndrome, this process doesn't go quite as planned, leading to certain heart issues. About half of all babies with Down syndrome are born with congenital heart defects. That's a much higher rate than in babies without Down syndrome, where only about 1% have these issues. The most common heart problems linked to Down syndrome include atrioventricular septal defect, ventricular septal defect, atrial septal defect, patent ductus arteriosus, and tetralogy of Fallot. Let's start with atrioventricular septal defect. This is the most common heart defect in children with Down syndrome. It involves holes between the upper chambers of the heart, called atria, and the lower chambers, called ventricles. It also affects the valves that separate these chambers. Because of these holes, oxygen-rich and oxygen-poor blood mix, which can cause the heart to work harder and lead to heart failure if not treated. Next is ventricular septal defect. This means there's a hole in the wall between the two lower chambers of the heart. It's found in about 35% of children with Down syndrome who have heart issues. This hole allows blood to pass from the left ventricle to the right ventricle, increasing blood flow to the lungs. This extra flow can cause breathing problems and make the heart enlarge over time. Atrial septal defect is similar but involves a hole in the wall between the upper chambers. It occurs in about 31.8% of children with Down syndrome who have heart defects. Like ventricular septal defect, it causes abnormal blood flow, which can put extra strain on the heart and lungs. Patent ductus arteriosus is a bit different. It happens when a blood vessel that normally closes soon after birth stays open. This vessel connects the aorta and the pulmonary artery, and if it remains open, it causes extra blood flow to the lungs. Though less common, it still affects many children with Down syndrome. Tetralogy of Fallot is a more complex condition. It involves for different heart abnormalities that result in oxygen-poor blood being pumped to the body. About 5% of children with Down syndrome who have heart issues have this defect. So why do these defects happen in children with Down syndrome? It all comes down to genetics. Children with Down syndrome have an extra copy of chromosome 21, which causes a gene imbalance. Several genes on chromosome 21, like DSCAM and COL6A12, are involved in heart development. When these genes are overactive because of the extra chromosome, they disrupt normal formation of the heart. Other genes outside chromosome 21, such as CRELD1 and ALK2, may also play a role through mutations. Molecular pathways like vascular endothelial growth factor, A, sonic hedgehog signaling, and folate metabolism are also involved in heart formation. Small molecules called microRNAs can influence gene activity and may affect how the heart develops in babies with Down syndrome. Environmental factors, like not taking enough folic acid during pregnancy, might also contribute, but scientists are still studying this. Because these heart defects are common and can be serious, early screening is very important. Doctors use fetal ultrasounds and post-birth echocardiograms to catch issues early. Detecting problems early helps families and doctors plan for treatment, which can include surgery or medication. Thanks to advances in medical care, many children with Down syndrome and heart defects now live longer, healthier lives. Genetic counseling can help families understand their risks and prepare for the best care possible. In summary, the heart defects linked to Down syndrome mainly involve holes between the heart chambers and some complex structural problems. These issues happen because of genetic changes caused by the extra chromosome 21 and related gene interactions. Early detection and treatment are key to helping these children thrive.